Everyone to the Reclaim Network Plus webinar series. And I have a pleasure of saying that we have this webinar number 37. So if you are not aware with the Reclaim, then Reclaim Network Plus is funded by the three councils, which is EPSRC, NERC, and AHRC. And it's led by the University of Surrey's Global Centre for Clean Research, in collaboration with the UKCEH, University of Bath, Warwick, and Bangor. So this is a webinar series which started long back. So as I said, it's number 37. It usually happens every Wednesday between 12:30 to 13:30. And this is a team of the investigators, starting with me and the colleagues coming from the partner institutions. They all bring in very diverse expertise, starting from ecological modeling to flooding to the blue infrastructure to the social science. And it's supported by our network manager, Mark Simmons and Charlotte Leedan. So this series basically, will be running now until February 2026, since we have got 6-month extension of the Reclaim Network Plus. So we'll be extending this date from August, where it was about to end earlier. And usually in this series, we have two speakers. So the first of the speakers, both speakers basically talks about 15 minutes, and then we have in the end, the time for the question and answers. So the last webinar we had was, by the two speakers you can see here, Dr. Jitendra Sahani from the GCARE team, talking about the school climate resilience, and Dr. Neria Calavillo, she's also the co-lead on the Network Plus, talking about the GBJ image and the database. So these webinars are recorded, so you can see them on on our YouTube channel. So we'll post the link in there. The network has grown quite substantially. We started with around 40 partners in the beginning. And as you can see, we are reaching around 700 members, which represents almost around 45 countries. So there is quite a lot happened. And they come from diverse background, as you can see, and with having a very diverse, the interest in terms of what the ecosystem services, these green and blue infrastructure could provide. And the activities has included a range of things, including funding the projects to the workshops, secondments, the large sort of event, GBJ database, and so on. And there is quite a bit of, this information you can find on our website, but also being sent actually to the members through the newsletter blog. So if you're not a member, you can join it for free. We'll post a link, or you can find the link right on the top of the webpage. So, I think one of the really rich resource actually we have created through the network is a lot of these digital recordings, which includes all these webinars which we have done so far. So this was 37 today, or this is 37 today. So all the 36 webinars you can find them on our YouTube channel. You can find actually the other, the information on the different events as well. So it can allow people to see it in case if they are not being able to join, during the time when they are being, done live. So today, if we can go next, we got two fantastic speakers, and I'm pleased to say that it's a UKCEH special today. We got Dr. Danial Owen. He's a Spatial Analyst at the UKCEH, and he will be talking about the opportunities and constraints of implementing the 330-300 rule, which is really interesting. And then we got another UKCEH a colleague, Dr. Kate Farley. She's a social scientist, and she will talk about a tale of two cities, health equity and regreening cities. So we've got two fantastic speakers today. Both of them will have 15 minutes each. I would request you all to use the Q&A box on the top to write your questions with your name and affiliation, so I can take those questions to our speakers. They will go one after another, and then we'll take all these questions towards the end. So without any further ado, I can introduce in more detail our first speaker, who is Danial Owen. He's a special analyst at the UKCEH, which is UK Centre for Ecology and Hydrology, working with colleagues to research green and blue spaces and their associated ecosystem services in the context of urban areas. Prior to UKCEH, Daniel completed his PhD at the University of Liverpool's Geographic Data Science Lab, where he used mobile phone and sensor data to analyze human mobility behaviors in cities. So welcome, Daniel. I'm looking forward to your presentation. Over to you.
Lovely, thank you. Just trying to multitask. Okay, I'll just assume that, please interrupt me if I've forgotten to unmute myself or if anything's not moving, but thank you very much for the introduction. I'll start my timer as well. Great. So my name is Daniel Owen. I'm a spatial analyst at the UK Centre for Ecology and Hydrology, so UKCEH. I'm based at the Bangor site in North Wales. Thank you very much for the introduction. Invite me for giving the talk today. And the talk I'm giving is on a piece of work that we conducted within the urban team at UKCEH a couple of years ago, or within the last year, as a part of the EU Horizon funded Regreen project. And that is looking at the opportunities and constraints of implementing the 330-300 rule. So I'll begin with a brief introduction to the 330-300 rule. Just a disclaimer to start with, we didn't come up with this, so we're not claiming that. But it was a person called Cecil Konynendijk that came up with the rule, and this piece of work was published or introduced in 2021. And what the 330-300 rule essentially is, I'm not sure how easy you can see that text that's highlighted there, but what it is a simplified and easy to remember rule or guideline that ensures all residents have access to trees and green and the benefits that these provide. So there's that heavy focus on ensuring that all residents have access to that equitable access to green and blue spaces. Now, within the 330-300 rule, there are three key components or three key targets that every building, workplace, school, residential home should strive for. And that is that they should have, the first one is the 3 component, they should have 3 viewable trees. The second component, the 30 component, is that they should have a 30% tree cover or canopy cover within their neighbourhood. And then the final component is that they should be 300 metres to the nearest park of 1 hectare in size. So now that I've given a brief introduction into the 330-300 rule, I'll give a brief overview of our study, so who's involved in the study. So this was the Regreen project, and on this specific piece of work, it was with colleagues from in UKCEH, so within there, the Helmholtz Centre for Environmental Research in Leipzig, Aarhus University in Denmark, Paris Region Institute, and more. And what we wanted to do was to take this 330-300 rule and implement it in our living labs within this project. And these were 3 very sort of contrasting cities. So we have Paris in France, we have Aarhus in Denmark, and Velika Gorica in Croatia. And now, why did we want to do this? So we wanted to do this essentially to test or to explore the feasibility of actually implementing this rule within existing cities and different cities. And the reason we do this is because the author notes when they introduce the rule that they are, whilst the idea of everyone having equitable access to green and blue spaces, and that the idea is a really good one, they are aware that the application will be more challenging. So that's the reason why we wanted to actually implement or create this scenario where we implement the rule in these 3 cities to see how feasible would it be to possibly implement the rule in these locations. Not let me, there we go. So what we did to implement the rule was we created a GIS rule-based approach to implement the rule in these 3 cities. And what we did was apply these 3 components sequentially. So we didn't do them separately. So current studies that have looked at the 330-300 rule have typically looked at the adherence of different cities worldwide and their adherence to each of those components individually. But to actually implement them, we thought that it might make more logical sense that if a city was to implement this rule, we do it sequentially rather than look at each component separately. Another thing to note in our study is that we adjusted the 330-300 rule slightly. So rather than looking at 30% tree cover or canopy cover alone, we did expand this to include all green and blue spaces. And one of the reasons why we did this is because the author, again, when they introduced the rule, did note that achieving or striving for 30% canopy cover alone could be difficult in some cities, specifically depending on climatic conditions. So there may be more flexibility to expand the scope of that beyond just tree cover, so to include also other types of green spaces. So what we did was we wanted to include, as well as green spaces, we wanted to incorporate blue spaces in that component as well. And what we used to implement the 330-300 rule in these cities was 5-meter resolution land cover. And this data is openly available on Zenodo for the 3 case study cities. And what we did was essentially use this 5-meter resolution land cover, which represented the existing conditions, and change these to create land cover scenarios of what the land cover would look like if we were to meet the rule in each city. And so both of those, the existing conditions and the scenarios, are on Zenodo. And I'll post a link to that later on in the talk. So as I briefly mentioned before, I mentioned what the 3 key components or targets were within the original rule. And in our GIS rule base, this is what the 3 components look like. So the 3 viewable trees, whilst we don't have data on individual trees, we had to use raster data, so 5-meter resolution raster data. We define 3 viewable trees as 2 tree raster cells within a 30-meter buffer of every single residential property in each of those cities. The 30 component, as I mentioned before, we did change this slightly, so this includes a 30% green and blue space cover within a 300-meter buffer of each neighbourhood, where a neighbourhood is defined in our study as a group or block of buildings. That's something that I found there was another debate, something I had to decide was how do you define a neighbourhood? And the last component, the 300, is the same as within the original definition. So the 300 component is that every residential building should be 300 metres from a green space of 1 hectare in size. I could bore you with more detail of more of the GIS and the workings in that, but I'm not going to do that today. So if you are interested in more of how we did this, how we created the scenarios in each of the cities, there is a link to the paper here. And I'll include the QR code in the top right-hand corner of the subsequent slide. So if you do miss this and want to read the paper, then you're more than welcome to and scan it there. So the results. Now, before I go to talking about implementing the 330-300 rule, the first thing that we wanted to do was to explore how each city adheres to each of those components given their existing conditions, so given their existing green and blue space within each city. So what we have in this figure is 3 concentric rings, where the inner ring is the percentage of the number of buildings that adhere to the 3 components, how many buildings have 3 viewable trees from their homes. The middle ring is the 30 components, so whether they have 30% green and blue space cover, and the final ring, the outer ring, is the 300 components, so whether they have access to that green space of 1 hectare within 300 meters. And as you'd imagine, what we find is that the cities perform very differently to each other, and also between each of the 3 different components within a single city. So, for example, in Paris, we focused on the central areas of Paris, so the heavily densely built areas with a lot of paved surfaces. And what we see is actually it performs really well with the three components. So a lot of the buildings, most of the buildings have 3 viewable trees. However, as you'd expect within Paris, within such densely built cities, it performs less well essentially on the 300 components. So less buildings have access to those larger green spaces of 1 hectare in size within the centre of Paris. So that's unsurprising to some extent. We compare that with cities such as Aarhus in Denmark, and that's a little bit of a contrasting picture with the 300 and the 30 component. They actually have a lot of buildings and neighbourhoods that have access to these open, large, accessible green spaces, and perform slightly less well on the 3 components, so less viewable trees from their homes. But the point here is that you could see that each city, given their existing conditions, performs differently, and no city adheres to the rule completely. In comparison to the last slide, these are the results of if after we've made all changes for each city to meet the rule completely. And in this table, I forgot to add the units, so apologies for that, but the units here are kilometres squared. And what we find essentially is that each city requires substantial change to meet the rule. What we find is that Paris, given we picked 3 contrasting cities, Paris is the largest city, so unsurprisingly it requires the biggest change in total area to meet the rule. So there's over 92 kilometres squared of new grassy areas and new trees. Most of this is from the new grassy areas. So again, to meet that 1 hectare of green space within 300 metres requires a lot of change in green space within Paris. And in contrasting in a smaller city such as Velika Gorica, whilst it has a relatively smaller change, so only 2 kilometres squared of new green space, it does have the highest proportion of its urban footprint, so its urban area that would be required to change in order to meet the rule. So over 18% of its urban footprint or urban area that would be required to change the green space to meet the rule. Now, what I found interesting as a spatial analyst and formerly as a social scientist is that the change required doesn't just vary between the cities, but also within the cities. So the change that required the green and blue space isn't homogeneous across all the area. So it's not uniform across the entire area. So I've just got a couple of snippets here. For example, in Aarhus there on the right, so you've got your before and after. So A is before, B is after, and that's the inner city centre of Aarhus. And what you find is that there's a big difference within Aarhus where the changes are required. So we can see that within the inner city centre, probably expected, where there's commercial areas, highly paved, less green space, that's where the change is required. So that's where the new areas of accessible green space are added, and that's where these trees are added within that city centre. However, surrounding the inner city centre and the more residential areas possibly, they already have quite a lot of green space there, so there's less changes there. So it's really interesting, this rule, to see how it's a lot more of a targeted approach to add the green space possibly where it's needed most. Just an example, another example from Paris on the left, just to show that some of these commercial areas, these inner city areas, this is where the most change is required. So we have an example of the second arrondissement in Paris, and we can see that on the top there is the before. We can see that it's got a high concentration of buildings, paved surfaces, and to meet the rule, we would actually need a big change in land cover. So it's just to show the change that might possibly be required in order to meet the rule. So as you'd imagine, because of the nature of the work, because of the nature of the experimental work, there were a few limitations that we had to consider, and possibly other avenues for future work, because the 330-300 rule as well is this new concept. So it was important as well that we recognise limitations. So the first one is that because we're not urban planners necessarily, our study doesn't fully consider where and how these interventions would be implemented. So I think if this was to be implemented, in reality, that's something that an extra step that would need to be considered, is how feasible in terms of space, in terms of cost, in terms of displacement of people, how these interventions would be implemented. Again, with our components, that's something that we recognise in the paper, as well as our 3 components. So our measure of visible trees is a relatively simple measure as well, because we don't have information on individual trees. So there is a degree of assumption there on what is classed as 3 viewable trees. So again, that's been recognised and something that must be considered. Another thing I found interesting is that a limitation of this method is that it doesn't consider vertical green. So in some compact cities, such as Singapore, I think it's Singapore, there's a lot of innovative new green spaces that's been added because there's that demand for space. So there's a lot more vertical green. And this is something that moving forward into the future, possibly that might be more important, that might be implemented more, is these more innovative ways of adding green spaces. So it would be really interesting to see how future work could incorporate not just your traditional open accessible green spaces, but also the vertical green and what benefits that they provide, and should they be added to such measures such as the 330-300 rule. So in summary, transformative change is needed to achieve that equitable access to green space and that big focus on equitable access to green space. And in my opinion, and again, with such targets, measures as the 330-300 rule, change must be at the local level. It must be targeted and not at the city level, because a lot of the measures before might be at the city level, for example, metre squared per capita. And such measures whilst they're really beneficial in some aspects, they don't show the discrepancies within the cities, which areas perform really well and which areas perform relatively poor. And as a social scientist, again, previously, that's the aspect that I'm really interested in. Where in the cities do people not have access to green space, and how can that be improved? So that's why I think measures such as the 330-300 rule is a really important and a really beneficial measure. And also the change that is required in each city depends, again, on the existing conditions, so how well it performs given its existing conditions and its ability to facilitate interventions. But that's something to think about in the future, and a conversation to be had more beyond academia as well with the cities themselves. And just to finish off now, some of the follow-up work that's come from this work. So we've worked with other colleagues within UKCEH with different ecosystem services, and taking the land cover scenarios from this work and seeing that if we were to add these new green spaces, what possible effects could that have on ecosystem services such as surface runoff flow, so the impact on urban flooding, some really important challenges the cities face. So that was a paper that was led by a colleague, Gianni Vesuviano, based in Wallingford, and also a talk that's going to be next and presented by my colleague Kate Farley. Is we looked at the interventions again, and what benefits could these interventions have on air quality and how that relates to socioeconomic populations, and that does tackling the disparities in access to green space also tackle other challenges such as air quality. And that's me, so thank you very much. Diolch yn fawr.
Yeah, thank you very much, Daniel. Very interesting presentation. So we will leave the questions to the end. So I would request all the people on the call on the webinar just to use the Q&A box and add their questions there, which I will pick up once we have our second speaker giving her presentation. So yeah, it's my pleasure now to invite to our second speaker, Kate Farley.
Good morning, good afternoon.
So Kate is a social scientist and interdisciplinary researcher with a background in health science. Her research focuses on the interaction of humans and the environment as it relates to health and well-being. Her primary expertise is in theory-led implementation and process evaluation of complex interventions, qualitative methods, and social survey design. She works in multi-partner research programs in which lived experience is a critical component. So Kate is interested in understanding the role of urban environment in mitigating the impact of extreme heat and how human behavior interacts with green space and blue spaces to reduce the impact of heat on health and well-being. So we are looking forward to you, Kate, now. So over to you.
Thank you. If you just bear with me one moment, please. We have checked this. Can you all see the full screen there?
Yes.
Yes, brilliant. Thank you. Thank you very much for inviting us today and for a lovely introduction. And a huge thanks to Dan there for such a great methodological introduction to the 330-300 rule, which as a social scientist and not a spatial analyst, I'm not in the same position to do. So that's a really nice introduction to what I'm going to talk about. So I work in the urban ecosystems team with Dan and colleagues. And I'm going to follow Dan's presentation with an overview of some work where we explored the potential health equity implications of the 330-300 rule, in particular in relation to air pollution, so particulate matter 2.5, and what the equity implications are of that for different health outcomes. Excuse me. So this study explored the relationship between exposure to particulate matter 2.5 and socioeconomic status in two of the three green living labs study cities. So that's Paris and Aarhus. And then the potential impact of the 3 and the 30 components of the greening rule on health inequalities in these cities by using sort of proxies for health socioeconomic status. So just to give a little bit of context, we're all familiar with the impact of poor quality air on health. There's already strong evidence of air pollution, including particulate matter, as a risk factor for non-communicable diseases, including respiratory, cardiovascular and psychiatric conditions, just to mention a few. And there's also lower self-reported health and mental health outcomes associated with poor air quality and an association with low birth weight. We know this has a significant impact on mortality and morbidity, with an estimated 4.2 million premature deaths annually across the globe. Adverse health outcomes from air pollution are greater for populations whose health, economic or environmental factors increase their vulnerability to those to poor health. Some populations have a higher prevalence of existing conditions, cardiovascular and respiratory conditions, as well as being more likely to experience an exacerbation of their symptoms as a consequence of exposure to air pollution. For example, the very young and very old and certain ethnicities. Although I should say that the evidence around ethnicities is certainly complex and mixed and very dependent on location, with research in the States looking very different to research in the EU. Excuse me. Socioeconomically deprived populations are also at greater risk from adverse health outcomes relating to air pollution, and they often, of course, bear the additional burden of living in neighbourhoods and areas that have a higher exposure to air pollution. In terms of evidence around variation in exposure across the EU, where our living lab cities are, and there are mixed patterns. There are the usual associations with deprivation, age, and some ethnicities, but particularly quite consistent evidence that immigrant populations often experience greater exposure in urban areas. So the emerging rule provides kind of guidance to improve equitable access to trees and therefore potentially improvements in associated health outcomes. But the rule hasn't been extensively tested in relation to this. So I'm not going to talk at length about the methods for applying the rule, as Dan has covered these really comprehensively just now. Just to remind you, the rule is that each workplace, school and home should have a minimum of 3 viewable trees, 30% neighbourhood tree canopy cover, and be within 300 metres of the nearest green space of a minimum of 1 hectare. So what our study really wanted to do was try and understand if there is a relationship between exposure to PM2.5 and socioeconomic status, and then what the potential impact of the regreening rule would be on health inequalities, taking in account that exposure level to PM2.5. So what we did was disaggregated social and demographic data. So that was age groups, income, citizenship status, education level and employment status, and disaggregated that to individual buildings. Land cover scenarios from the rule, specifically the introduction of new trees, were applied to calculate PM2.5 removal across the cities. We then calculated the population average PM2.5 removal for each socioeconomic subgroup. Population weighted average represents the average PM2.5 reduction that would be experienced by an individual in each of those respective groups. I'm just going to present today some of the limited results from the study in the 2 cities. So if we look at Paris at baseline, so this is the existing baseline exposure to PM2.5. The overall city population weighted average, I don't know if you can see there we are, population weighted average was 15.3 per cubic metre, which is actually about 50% higher than it is in the statistics we found in Aarhus. So this top map represents the baseline exposure to PM2.5, with those darker areas representing much higher concentrations. So we can really see here that there's poorer air quality found really across the north here, and then partially to the south and the southeast, with some other concentrations, I don't know if you can quite see on the map, in these central metropolitan districts, although there is some variability even within those districts as well. Baseline population weighted concentrations for each of the population subgroups are shown in this table over here. You should note that the variation in exposure between different populations was really small, regardless of the characteristic and the variables included. The relationships between socioeconomic group or age group and exposure to PM2.5 are really not clear cut. However, in general, populations that we would generally consider more vulnerable to adverse health outcomes, and we recognise this is not a clear relationship. Those that we would consider more vulnerable, for example, those who are unemployed, those are from non-citizen populations, people with lower education level, and those in probably the lowest income quintile, are in general exposed to higher concentrations of PM2.5, which you can see highlighted there in red. Excuse me. In contrast, for age, more vulnerable populations, which is those of under 18 up here and those over 65, had a lower baseline exposure relative to those working populations. The greatest variation between groups was actually in the income. So we compared the bottom quintile, the top quintile, and then those three middle quintiles. Well, we can see actually the middle quintiles have a much lower exposure, with by far the worst exposure being for those lowest income groups. However, there was some raised levels across the higher income groups, suggesting there is some variability depending on where people live, which we will come to briefly later. The second map shows a distribution of the population in different income quintiles, with the darker ones indicating the higher income. Typically, more affluent areas are down here in the west and southwest, where we know that air quality is also better. Although there are some high income groups in that centre where we know there are pockets of really quite high PM2.5 concentrations. What's really clear here, though, is that those poorest areas are located where there are higher concentrations of PM2.5, particularly this area stretched across the north of the city, which corresponds to the darker areas up here in the other map. Sorry. When we come to Aarhus, overall air quality is better. It's closer to that threshold of 10 that the WHO was originally looking at, aiming for. Air quality is better. But we can see in this map that concentrations of poorer air quality are found here in the city centre area and down here in the south, just bearing in mind that this is a coastal city, so this area on the white is the sea. Excuse me. In contrast to Paris, though, the populations with higher socioeconomic status, which on the whole, again, we expect to have lower vulnerability to adverse health effects, are exposed to higher concentrations of PM2.5. So we can see those red scores for people with higher education levels, for citizens, and down here for the employed. This is the case in terms of citizenship, education, and employment, but age differs as there's a little bit more complexity around the patterns there. As for Paris, the greatest variation was found identified between income groups. The socioeconomic group exposed to the poorest quality air was actually the highest income quintile. So those we would expect to have better health outcomes, and elsewhere, particularly in the United States, would always be associated with much better air quality. Looking at the map there over here on the right, a large proportion of those areas with the higher incomes correspond with areas with a slightly higher concentration of particulate matter, but obviously the picture again is complex. So in terms of then applying the 3 and the 30 components of the regreening rule, in Aarhus, again, mitigations from the rule had a very small impact on the levels of PM2.5 across all populations. We can see there the change from 10.64 to 10.61. For some characteristics, a relative improvement was observed for populations that had the highest baseline exposure, although the overall relationship between socioeconomic categories and exposure remained the same. So we can see here for education, for example, the worst exposure was for people with tertiary education, but they actually experienced some of the biggest improvements, although again, the variation is very small. For age, larger improvements were found for the working age population and the older population, but they still have poorer air quality relative to younger people and in education relative to primary education populations. One clear exception was for the income variable. So the greatest improvement there for a single socioeconomic group was for people in the lowest income quintile. However, this group already at baseline had the lowest concentration of PM2.5 relative to other income groups. So there's no improvement in equity there at all. In Paris, the picture is slightly different. The impact of mitigation on overall concentrations again was really small, but a little bit larger than it was in Aarhus. So there is an overall improvement of air quality of introducing the rule. By far and away, the largest improvements were found for the highest income quintile, which therefore results in the difference in air quality between the very poorest and the very richest actually widening compared to how it was before. So this pattern was observed again for employment, for citizenship, and to a certain extent education level, where those less vulnerable populations, the employed, those with citizenship, etc., actually all benefited the most from the intervention, with the greatest decrease in exposure relative to those more vulnerable populations, despite having an originally lower baseline exposure. So the rule had a much greater impact on working age adults and older people than for children and young people. So although this reduces the inequality in exposure across these groups, especially for those, for example, in working age who may have an existing vulnerability, given the higher vulnerability in children due to their developing physiology, etc., the potential for public health benefits there might be more limited. So applying the guideline improved air quality really for all populations across both cities, including those who are more likely to have sort of health vulnerabilities and a higher baseline exposure. However, there were different effects on inequities. In Paris, the application of the rule improved air quality for all populations, but didn't reduce that gap in exposure between the more and less privileged or more and less potentially vulnerable groups. On the whole, the largest improvements were found for those who had both the lowest exposure at baseline and were also less likely to be vulnerable to adverse health effects. For example, those at the tertiary level education. In fact, the greatest benefit from the rule was the populations in the highest income quintile. In contrast, in our other city, in Denmark, bigger improvements in air quality were experienced by populations which had the highest baseline exposure, thus narrowing the gap in actual exposure levels between different groups, although maintaining the same overall relationships. The groups in that city receiving the greatest improvement in air quality were also likely to be those who might be less vulnerable to adverse health outcomes. Therefore, the potential impact on public health is likely to be a little bit smaller. So I say quite a few conclusions. It's clear that reductions in PM2.5 concentration can be produced via these targeted increases in trees. And there is likely to be a reduction in adverse health outcomes possible from this due to the improvements in air quality. However, the impact on public health outcomes depends really, well, in part on the spatial distribution of socioeconomic groups already. So the gap in exposure between high and low income groups who were quite clearly associated with with higher levels of chronic condition in low income groups aren't always going to be decreased. And the rule in both cities actually gave more benefit to those who already had likely lower vulnerability. So this means there is, as Dan said, there's opportunity here, but there's also potential to actually widen inequalities, even if we're improving health outcomes, depending on the existing quantity and type of green space. And we are really conscious that the changes that we're looking at here are extremely small. So any intervention like this as a means to improve air quality, to improve health outcomes, really have to be part of a much bigger, multifaceted programme of change. What I really feel as a social scientist this illustrates is that there is huge environmental injustice of applying any kind of rule blindly. I know Dan talked a little bit about applying to a city versus local areas. I'm thinking a little bit also about how we understand the communities and the neighbourhoods that we apply these rules to, which means really that understanding how these rules are implemented and how they maybe interact with cultural and social and mobility kind of access is also really important. This is in part because of the the notion of triple jeopardy, where lower socioeconomic status communities face those triple threats of increased susceptibility to ill health, higher exposure to pollution, and health disparities driven by other environmental hazards. And we really need to understand the complexity of those triple threats together and understand how behaviour and other factors in terms of security, etc., might actually interact with engagement and benefits of those spaces. However, although the effect of this is very small in actual reductions in PM2.5, and there is a complexity around implementation, green infrastructure offers a much wider range of health co-benefits. We're also looking at noise reduction, shading, mental well-being, and particularly heat and heat mitigation and social connectedness. So in understanding the potential benefits, particularly around health, of regreening our cities, really requires an integrated analysis of those ecosystem services and health benefits that are going to be derived from there. And that's just a last QR code link to the paper that Dan has just presented. This work I presented today is currently under review, and hopefully we'll see it publicly later in the year. Thank you.
Thank you very much for Kate and Daniel for the fantastic presentations. And they went along very well in terms of building upon the work Daniel presented and keep on going with the looking into the exposure for the PM2.5 in the context of this 330-300 rule. So I would invite actually the colleagues on the call to write their question and answers in the Q&A question. I've got a couple of them to ask, but maybe I could start with mine actually one. So this is for Daniel, for you basically. What is the rationale of 330 and 300? Why not 220, 200 or 440, 400?
Good question. I think in the original paper, so the one that was published, not the 2021 one, but there was a more detailed paper published in 2023 after, they said there was a lot more evidence within the literature with the 30% tree canopy cover. It's already this target that's already set in a lot of policies, and within that green space of 1 hectare in size. So there was a lot of evidence based on those. Whereas they said for the 3 viewable trees, they couldn't find a rationale, and they just wanted something that could be easily remembered. So they just wanted that follow on from 330, 300, because it was that balance of finding something that was scientifically backed within literature, but something that could also be translated to policy and something that could also be translated to a wider audience and be hopefully implemented.
It has nothing to do with the health outcomes of the exposure to these. So it's not based on the health, it's more based on the planning and what's available in and around cities.
I think it was also to do with health as well. So apologies, I can't remember off the top of my head. I think the 30% canopy cover was also linked with health as well, because those targets that are set by policy as well is also linked with health. So indirectly, yes, it will be linked with health, except for the 3 rule. 3 rule was there purely for convenience.
Perfect. Thank you. I'll ask one for Kate, and then I'll go on to the list of questions there. So, Kate, very interesting, and I think this quite interesting to see the taking that into the PM2.5 exposure context. What I noticed actually in France, your concentration differences into different groups, it ranges from 15.28 to almost 15.46, basically. So, in a sense, actually, it is within plus minus 1 microgram per meter cube, right? Yes. And when it goes to RS, it's even lesser, actually. So it's like 0.5 microgram per meter cube of difference. And this is based on the model data, which already have quite a bit of uncertainty in the data set. So the question really is, could we really say that higher or lower based on this very little fraction, which to me looks to me is a modest difference, and you can't really make a conclusion by saying that this higher one, the higher exposure or lower exposure there. So what's the rationale or thinking behind it?
Yeah. I mean, I agree, and we've discussed this at quite a lot of length within the team. I think what we really want to emphasise is this is potential for change, and really illustrates that this potential could be inequitable, depending on what implementation looks like. But yeah, we completely agree that the impact is very, very small, and there is obviously uncertainty with this, but there is some direction of travel. And if rules like this were scaled up, this could potentially contribute to increased health inequities. And that's something that we'd want to be concerned about, particularly in the context of one of the cities where, obviously those who are already struggling already have high vulnerability. So there's a differential there, actually having far worse health outcomes, and not assuming in an urban planning context that just by planting more trees, we're going to be achieving benefits for everybody and for those who really need them. I mean, there's no economic analysis here, and I would want to see greater differences before we started estimating the potential for economic improvements, if that made sense.
Yeah, thank you very much. Yeah, that makes sense. So I'll pick up the questions now here. So there's one from Jacqueline Belcher, who is one of our PhD students at GCARE. She asked, thank you, Daniel, for the lovely presentation. What are the next steps for your research? Are there future plans to trial a test pilot project and work with the municipality and urban designer to supplement the team?
Lovely, thanks for the question. So not directly with municipalities, but it is a conversation that we've had when we've gone to conferences. So for example, the iTree conference up in Dundee last year or 2 years ago, I can't remember, I have no idea when it was, and also the Ecosystem Service Partnership Conference, so ESP. So it's something that municipalities are aware of, and we've had conversations. I think one conversation I had was with somebody from Milan, and they said they're not necessarily implementing the whole 3 components, but they are focusing on 1 or 2 of them. So there is definitely scope there, but I'm not directly doing that in the minute. One thing that we are doing at CEH is a toolkit that we're currently working on, which the 330-300 has potential, is the City Explorer toolkit. Mm-hmm. And that is a toolkit that enables policymakers and planners, hopefully, to make those changes themselves. So if they have a set of interventions that they want to plan, they can draw them up themselves, they can create their own scenarios and can then quantify the benefits. So it's something that the City Explorer, so a colleague of ours, David Fletcher, and Lawrence has been working with developing this toolkit. So I'll post a link of that into the chat now, and hopefully that has more of a direct relationship with working with those municipalities and making those changes and being able to quantify what benefits that would have. I tried to copy and paste the link, but it didn't work.
Yeah. All right. Yeah, thank you very much. So there's a question for Kate from Jacqueline again. Thanks for the presentation. Is there a correlation with the level of particulate matter and the location of road networks and traffic levels? If there is a correlation, urban greening should be supplemented with completeness, active travel infrastructure, renewable powered transport, and fossil fueled vehicle free zones. What are your thoughts?
That is an excellent question, Jacqueline. Thank you. So in terms of whether we observed a correlation with road networks and traffic levels, that wasn't part of this particular study. I don't know whether, I don't want to dump this on Dan too quickly. I don't know whether there is any evidence of that. We do know that other studies have shown that actually one of the reasons potentially that some of those more wealthier people have got higher levels of PM, higher exposures, because they live in the real city centre in Paris, where there is a lot of kind of emissions from traffic that is delivery vehicles and things like that, where there isn't much release for that. But no, we didn't look at that. However, your comment underneath, I couldn't agree with more. For me, this is about multifaceted, really connected interventions, complex interventions in urban areas that really look at behaviour alongside other policies as well. And I think things like ultra low emission zones, support for active travel, and for me, things like active travel, it has huge individual co-benefits regardless of the reduction in emissions as well, mental and physical health benefits, as well as social connectedness and things like that. So I think, for me, even if there isn't a correlation, I think just regreening cities, just having ultra low emission zones, and just having active travel, in those things independently are not going to achieve the kind of changes and equitable outcomes that we're really looking for. It needs to be a combined and sustained approach.
Yep, great, thank you. There's another question for you, Kate, from Charlotte. She's based at the GCARE as well. She asked that, did you see a problem with gentrification in areas with improved air quality, with lower income households being pushed out?
Yeah, we didn't explore this. However, again, this is another sort of issue that arises in terms of environmental injustice and who actually experiences unanticipated or potentially anticipated outcomes of environmental interventions like this. We know that sometimes for things like ultra low emission zones actually prevent people in very low income jobs from doing those jobs. We're thinking in the UK around carers and things like that who do need a vehicle in the city to travel. So that sort of environmental injustice is really important. And though we didn't look at it here, certainly other evidence really indicates that you can undo a lot of good work as areas become gentrified, so that they become much more appealing and they become much nicer, and then therefore property prices increase. There is a paper I found last year that actually looked at, in a few European cities, I think, looked at house prices and their relationship with some policies, environmental policies, which I won't look for now, but I will try and have a look for, because I thought that was a really interesting relationship to explore.
Good. So, if there are any other questions, please do write in the Q&A chat box.
Yeah, there's one new one from Nina.
One from Nina. Okay, so let me check. Where is it? Is this in the Q&A? Oh yeah. So we got one from Nina Guy. Thanks both of you for the talks. Very interesting. Is there a risk that air quality could decrease at particular times of the year due to pollen from vegetated areas or trees?
Yeah, I think Dan's going to answer this properly, I think. But I think for me, this is a really important question that we don't talk enough about the disbenefits of these kind of ecosystem services. I don't know if you want to add to that.
Yeah,
Dan?
No, and I think I'll try to answer it. Neither of us are air quality experts, so I'll try to do that. I think it is something that has been mentioned, and it's something that when doing this work is something that I've read up as well on, is that just adding trees sometimes isn't the best, because you have these street canyons, for example. If you do have tree cover, then that can trap the particulate matter in those areas. The air quality model that we use and the data from that was relatively coarse, so didn't have that resolution. We couldn't incorporate that, although we would like to. There are other more sophisticated models that can, I think, predict the level of air quality on a transect of a street, for example. But that's something that would have been too complicated to incorporate into what we wanted to explore. But it's a really good point, and it's something that, especially, for example, the interventions in Aarhus, many of the streets within the city centre were completely covered with trees, just given this simple approach. So it's something that if you were to apply blindly without any further research, it could cause disbenefits instead of benefits. So it's definitely something that's really important to consider. And a great question.
Yeah, so I don't think there are many other questions there, but let me check again. But maybe I can ask one question from both of you. This is really interesting research, and the work you have done is I think it basically gives the state of the art in terms of what's happening in these big cities, and how do they, in terms of the comparative assessment, it's quite interesting to see how do they compare in different contexts, especially 330 and 300 thing. What do you think are the research gaps actually, which possibly could be filled? Maybe there are a lot of these young researchers on the call. It might benefit them to think along their research, whether they can align some of their thinking in these lines. So what do you think, as a, as the research direction, what could be done more actually by the researchers in this particular area? It's an open question, but just some thought possibly.
It's a good question as well. I think the gaps in the research for me personally would be something that we've touched on, and what Kate's touched on as well, is that is more of that integrated approach, and not just to look at things blindly and to say, we need more green space here. There's a lack of green space here, so we need to add it there. We also need to consider the other aspects that other fields might have insights into. So whether that be social scientists, health workers, it's more of that integrated approach. And I think that's possibly for me what would make an intervention more likely to be implemented by cities in the future.
Mm-hmm.
Oh, thanks, Dan. You just said what I was going to say. I mean, that, yeah, an integrated analysis of the multiple co-benefits. So flooding, air quality, heat mitigation, noise mitigation, all of these, and biodiversity, of course, all of those things together needs to be done. And I think I'd put it slightly differently to Dan, but yeah, really understanding how we can maximise the effectiveness of interventions like this through better understanding of people's behaviours. And responses towards them, whether that's housing market or individual engagement.
Okay, perfect. So this is really good, actually. Does anyone else have any questions? Let me check again, just to make sure that I'm not missing out on anything. Yeah, so I think I would like to then take the opportunity to thank both our speakers. They did a fantastic job with the presentation. I was quite impressed with the timing as well. You were bang on time, so there was plenty of time actually to ask questions and have the discussion around the topic area. So thank you very much. So let's give a big applause to our, the speakers for their fantastic work today. Thank you. Before we close, I would like to take this opportunity to introduce our next webinar, which is going to be on 2nd of July, the same time, 12:30 to 13:30, the UK time. And we've got two fantastic speakers coming up. So the one comes from the UKCEH, Dr. Gianni Vesviano. He's a hydrological modeler, and he will talk about, again, the 330-300 rule, but in the context of urban flooding. So you can hear more about the rule and how this is working in different areas. And then the second speaker we have is Victoria Turner. She's an impact coordinator for Trees for Cities, and she'll be talking about impact of school greening work. So again, excellent talks coming up. So please sign up in the next webinar. But just before we sign off, just to say that if you are not a member of the network, you could go onto the reclaim-network.org. You can become a member for free. It's a small form you need to fill in, and you will start getting a lot of information on the activities of the network and also the opportunities for funding and enhancing your research impact. We are there on the X, so you can follow up on X also for the updates, and on the LinkedIn. So you can see the links there, but we can paste that in the chat box as well. And if you have any questions for us, or if you want to be a speaker on the upcoming webinars, please drop a line to any of the team members or write on to the info@reclaim-network.org. Last thing to say, because everyone on the call might be doing something with the green infrastructure, we have got a fantastic resource page which we have created as part of the Reclaim Network Plus. So we'll post the link there in the chat box. So you can please submit your your publications which you have published on the topic area there. So it can allow you to, you can just use this form there, and you can fill in. It will allow you to then add those papers onto this onto this platform, so which is accessed by over 700 people. So it might be an opportunity for them to see your research, but also could help you in terms of getting more citations, more visibility of your work. So all of you are invited to please submit your work on the resources page. So with that, I would like to thank everyone, especially our speakers and the people working in the background, Charlotte and Mark, for the fantastic work, and all the people on the call for their valuable time to attend this webinar, which will be available on the YouTube. So you will hear back very soon, with the link there. So thank you very much, everyone. See you next time around. Bye.
Bye.
Bye-bye.